We've got to address those problems without, I think, destroying what is for most people the best health care in the world and the access that we have to it on a personal level. There are proposals as far as the government takeover and option in the health care system today. A lot of people have expressed grave concerns about that both ways, but there are 3 bills in the House of Representatives. One is the funding bill and through the Ways and Means Committee. It's about $1 trillion that they're trying to pay for this initiative. $500 billion of that would be in new taxes. $500 billion would be in cuts in Medicare and Medicaid. So that is of grave concern, certainly in our rural communities with the reimbursement level as low as it is today, and then to have additional $500 billion cuts in Medicare and Medicaid. In the policy part, probably the bill that everyone talks about coming out of the Energy and Commerce Committee, that H.R. 3200, they have the government option, the government takeover of the health insurance of the 170 million Americans who currently have their insurance through their employers. Estimates are anywhere from about 80 to 120 million people would go into the government option. The employers would basically dump it off onto the government as far as providing that care. Portability, I think, is extremely important. Under the current law, states have jurisdiction over the insurance in their state. Outside of the ERISA that I talked about, say like IBM that has employees all over the country, that comes under the ERISA. But any group that you might want to join simply has to be statewide, cannot be national at this point. I think that is another reform that we should be able to agree on, I think, on a bipartisan basis, is to have, say, the association healthcare plans where if you've got a small business, maybe you're a printer in town, that you could join together with all the other printers around the country, have one association, have bargaining power with for an insurance plan for your employees. And also, I mean, if as individuals have a nationwide pool, or for you to be able to purchase insurance in South Dakota if you want to. That's, to me, makes sense. I mean,